Hello everyone and welcome back to MediInsights. Today, we're diving into an important medication used in emergency cardiac care, Tirofiban Injection. We'll cover its uses, dosage, mechanism of action, potential side effects, and crucial safety precautions. If you or a loved one needs heart-related treatment, this is vital information. Let's get started. Welcome to our discussion on Tirofiban Injection. Tirofiban is an injectable antiplatelet medication used in the treatment of serious heart conditions. It helps prevent blood clots in patients with acute coronary syndrome, or ACS, and those undergoing percutaneous coronary intervention, also known as PCI, such as angioplasty. Since Tirofiban affects blood clotting, it is administered only in a hospital setting under strict medical supervision. Now, let's explore the uses of Tirofiban injection. Tirofiban is used for acute coronary syndrome, which includes conditions like unstable angina and ischemia, or non-ST elevation myocardial infarction, where the risk of heart attack is high. It is also used during percutaneous coronary intervention, or PCI, such as angioplasty, to prevent blood clot formation in the coronary arteries. Moving on to administration and dosage, Tirofiban is given as an intravenous infusion under continuous monitoring, and it is strictly for hospital use only. The dosage is determined by a doctor. Typically, the initial loading dose is 0.4 micrograms per kilogram per minute over 30 minutes, followed by a maintenance infusion of 0.1 micrograms per kilogram per minute for up to 18 to 24 hours. Because Tirofiban is excreted by the kidneys, the dosage may need adjustment in patients with kidney issues to prevent excessive bleeding. Let's discuss how Tirofiban works. Tirofiban is a glycoprotein IB/3A receptor antagonist, which means it blocks a specific receptor on platelets, preventing them from sticking together and forming clots. By inhibiting platelet aggregation, Tirofiban helps maintain smooth blood flow through the heart's arteries, reducing the risk of blockages that could lead to heart attacks. While Tirofiban is effective, it carries certain risks, the most significant being bleeding. Common and serious side effects include bleeding, which can involve nosebleeds, gum bleeding, gastrointestinal bleeding, or even serious internal bleeding. It may also cause a low platelet count, known as thrombocytopenia, which increases bleeding risk. Some patients may experience low blood pressure or hypotension, which can cause dizziness or fainting. Allergic reactions, such as rashes, itching, or swelling, may occur, along with other side effects like nausea, headache, or reactions at the injection site. If you notice severe bleeding, unusual bruising, or any concerning symptoms, please inform the medical staff immediately. Finally, here is some important safety information for using Tirofiban. Tirofiban must be given in a hospital under strict monitoring. Because it affects clotting, doctors will carefully monitor bleeding risks and adjust the dosage accordingly. Patients must be closely watched for any signs of excessive bleeding or hemorrhages. Tirofiban is not safe for patients with active bleeding disorders, recent surgery, or severe hypertension. Additionally, it may interact with anticoagulants, antiplatelet drugs, and NSAIDs, increasing bleeding risks. Always inform your doctor about any medications or supplements you are taking. By the end of this video, you now have a complete understanding of Tirofiban injection, its uses, dosage, mechanism of action, risks, and safety precautions. Always rely on medical experts for proper treatment. If you found this video helpful, stay tuned for more insightful health content. See you in the next video on MediInsights.